Nurses play a critical and multifaceted role in the field of mental health, providing a comprehensive care that addresses both the physical and psychological needs of the patient. Good day, everyone. We are here to present to you our study entitled Self Assessment of Knowledge, Perception, and Attitudes Among Student Nurses Towards Mental Health, presented to you by Valdez, Velasco, and Villanueva.
This study aimed to answer the following questions. Number 1. What is the demographic profile of student nurses according to age, sex, and year level? Second, what is the level of knowledge, perceptions, and attitude among student nurses towards mental health? Number 3, is there a significant difference in the level of knowledge, perception, and attitude among student nurses towards mental health and demographic profile? And lastly, is there a significant relationship between the level of knowledge, perception, and attitude among student nurses towards mental health and demographic profile?
Next, for the methodology, the research design for the study utilized a quantitative, descriptive, correlational approach. Quantitative research methods focus on devising, designing, and executing strategies for gathering and analyzing data. Descriptive research methods are applied to outline the features of the variables being studied. In the context of quantitative descriptive research methodology, the emphasis is on answering what questions rather than exploring the why behind a particular study topic. For the study sample, using a Cochrane sample size calculator, we have a cluster size of 244 for level 1, 189 for level 2, 212 for level 3, 267 for level 4, totaling to an amount of 911. And for the sample size, we have 54 for level 1, 44 for level 2, 50 for level 3, and lastly, 61 for level 4, totaling to an amount of 209. For the instrument utilized in the study was a research-made questionnaire adapted from the Indonesian study by Puspitasari I et al. 2020, titled Perceptions, Knowledge, and Attitudes Towards Mental Health Disorders and Their Treatment Among Students in an Indonesian University. The knowledge questionnaire comprised of 10 multiple-choice items. Correct responses were awarded a score of 1, while incorrect answers received a score of 0. Scores on the questionnaire range from 0 to 10.
Moving on to the results and discussions. Starting with Table 7, it shows the demographic profile of the participants. The demographic data of the students' nurses was determined using the frequency and percentage in accordance with age, sex, and year level. The results indicated that ages of participants varied from 18 to 23 years old. The distribution of participants across different levels was almost equal, with Level 4 having the highest proportion, followed by Level 1, Level 3, and Level 2 with the lowest percentage. Table 8 presents the findings on student nurses' knowledge, perception, and attitude towards mental health. Overall, the results are positive, indicating high levels in all three aspects. Specifically, the mean score for knowledge is 8.77, suggesting a strong understanding, although the limited number of items in the assessment tool might affect the interpretation. Moreover, perception and attitude scores are also high, indicating sufficient training in psychiatric nursing, regardless of exposure in the field. Table 9 addresses the third statement of the problem regarding the significant differences in student nurses' knowledge, perception, and attitude towards mental health based on their age. Using the Kruskal-Wallis, the significant differences were determined students aged 18 and 19 showed a statistically significant difference in knowledge compared to those aged 22. However, no significant difference was observed in perception based on age. Table 10 highlights the lack of significant difference in knowledge, perception, and attitude of nursing students towards mental health based on their sex. The Mann-Whitney-U test revealed no significant association between sex and these variables. This suggests that neither male or female students have greater advantage in knowledge, perception, or attitude towards mental health. Table 11 highlights the significant difference of year level in knowledge, perception, and attitude towards mental health. A Kruskal-Wallis test revealed statistically significant differences in knowledge between students in Level 1 and Level 4 and between Level 2 and Level 4. This suggests that students in Level 4 possess a significantly stronger understanding of mental health compared to those in Level 1 and Level 2. Analysis demonstrates a similar pattern for attitude, Significant differences were observed between students in Level 3 and Level 4 and Level 1 and Level 2. This indicates that students in Level 3 and Level 4 likely to hold a more positive attitude towards mental health compared to their counterparts in Level 1 and Level 2. Table 12 reveals a significant relationship between nursing students' perception and attitude towards mental health according to age and year level. The analysis shows that perception and age do not have significant relationships, suggesting age may not influence perception significantly. Similarly, perception and year level also lack significant relationship, indicating perceptions remain relatively consistent across academic years. However, attitude demonstrates a significant relationship with both age and year level. This suggests attitudes vary notably across different age groups and undergo shifts as students progress through academic journey. Table 13 illustrates the significant relationships between participants' knowledge levels and demographic factors. The findings reveal a modest correlation between knowledge in age and knowledge and year level, suggesting that knowledge tends to increase with age and educational progression. Conversely, there was no significant correlation found between knowledge and sex.
The study investigated the level of knowledge, perception, and attitude of student nurses towards mental health. Results indicated for the SOP1, which is the demographic profile of the sample population, was that of student nurses' age ranges from 18 to 26 years old, sex of both male and females, and a range of level 1 to level 4 student nurses. For the SOP2, the results displayed a high level of understanding and knowledge, positive perception, and attitude of student nurses towards mental health. The results reveal, despite the given variables such as age, sex, and year level, all students showed high levels of knowledge and positive perception and attitude towards mental health. Therefore, the researchers can conclude that student nurses from the University of St. LaSalle are well aware and prepared when it comes to handling mental health issues, thanks to the quality education provided to them, despite the given stigma and false information that is circulating the internet where almost each and every student is active. Based on the study findings, the researchers come up with some recommendations that are addressed to the following stakeholders. To decrease the mental health problem stigmatization in the country, the researchers recommend that the government and policymakers create and strengthen mental health policies and distribute funds for mental health campaigns to raise awareness. To reduce mental health stigmatization and improve the quality of patient care, the researchers recommend that healthcare providers advocate for mental health awareness by sharing knowledgeable information and offering support to those in need. To ensure students' mental well-being, the researchers advise university administrators and staff to uphold or enhance mental health support services, develop or refine mental health policies, and allocate resources more efficiently to bolster student well-being. To create excellent healthcare givers in attending to patients with mental health problems, the researchers recommend that the nursing faculty and instructors enhance or maintain current strategies that focus on comprehensive understanding of the extent to which student nurses are informed and prepared to address mental health issues, specifically those that target the level of knowledge, perception, and attitude of student nurses towards mental health. Student nurses enhance their attitudes toward asking for help or helping classmates who might be struggling with mental health issues, as well as helps students better understand mental health and lessen stigma. Since student nurses are the future frontliners that spearhead situations where mental health issues can be seen on a day-to-day basis, it is important that they should have a higher level of understanding in order to prepare them properly on how to address mental health issues so that we can have a healthcare workforce that is well equipped to address these challenges. And lastly, for the future researchers, it is recommended to include variables that were not included in this research, also to make questionnaires highlighting the knowledge part and to focus on the least correctly answered questions. Additionally, using more detailed questionnaires that target areas where students lack knowledge can help having a better understanding on how student nurses perceive mental health, explore clinical competence, confidence in managing mental health patients, and comprehensive assessments in psychiatric nursing. You may scan our QR code for the references, and that is all for our presentation. Thank you so much for watching.